everyone. Hi again. My name is Dr Khaled. I am one of the GPs in the UK, and welcome to all of you to my SCA Q&A session. I hope you all enjoy it, and I would like to start by congratulating to everyone who actually have passed their exams in June. So well done. Thank you so much for sharing your experience with us, and that actually made a huge difference knowing that you passed. And I was very, very happy and very cheered to know about all of your successes. So thanks so much for sharing your successes with myself. So today it's going to be a very hopefully very fruitful session. You're going to enjoy it. And also we have one of our guests, one of the top scorers of the SCA ever. So we have Dr. Hisham with us. He had just passed his exam in June. So congratulations, Dr. Hisham. In addition, he didn't only pass, he scored 109.5. So that's a massive score. So well done, Dr. Hisham, and congratulations. Dr. Hisham, you are with us at the minute. So how are you doing?
Thank you very much.
Well done, Dr. Hisham. Well, I was going to say, I expected that you're going to pass anyway before your exam. You did really a very great job, so well done. And I'm hoping all the best for you, and I'm sure that you're going to smash your career as a GP very soon. So we're going to have a chat with Dr. Hisham at some point. However, we're going to start our session today with SCA Q&A, so questions, and I'd like the session to be very interesting, very interactive. I'd like to ask some questions. I would like you to answer my questions, and if you have any questions, please let us know, and then we'll move on. We'll speak with the brilliant Dr. Hisham, and we'll gain his experience in the SCA in order to share that with you. He volunteered, thankfully, to provide you with all of the information that you need to know about his preparation and how did he manage to tackle the SCA exam. So now we're going to start with the first question. So our first question for today: what's your biggest fear about the SCA? What's your biggest fear about the SCA? Anybody would like to answer this question? What's your biggest fear about the SCA? What do you normally get to worry about? If you haven't appeared for the SCA before, what are you worried about when it comes to the SCA? And
not
if
passing.
you have, sorry, Dr. Rehan?
Not passing.
Not passing, okay, of course, well done, yeah, definitely. Actually, that's one of the biggest fears of the SCA exam. Okay, what else? What else? What's your biggest fear about the SCA?
Well, if you have the knowledge, but you are bad at time management, you know, it's
Definitely. Exactly. Well done, Dr. Rehan. So now let's speak about that, because that's a very important thing. Thanks so much, Dr. Rehan, for sharing that, because now I can imagine no one of you are all brilliant doctors. You have studied enough in order to be in that stage now. So all of you, almost all of you, you know how to manage a patient in the GP setting, okay? But it's not only about knowing the management plan, it is about how to apply the management plan to your patient in just the 12 minutes. Of course, the management plan itself is actually 6 minutes, but about managing the whole patient, because if you don't manage the patient early on in the data gathering part, you will not be able to manage the patient in the management part, unfortunately. You will be so late, even though if you are the most brilliant doctor in the world and you cannot apply your knowledge. So unfortunately, the SCA exam is something I call it as a driving test. Driving test. even though if you're the best driver in the world, however, in the driving test, if you didn't, or you made major faults, you're not gonna, you're not gonna pass the driving test, even though you're the best driver in the world. Okay. Anybody else has any fears about the exam apart from not passing, apart from not being able to manage the patient in 12 minutes? Any other fears? Share it with me. I'd like to hear your fears, doctors. Anybody else is worried about anything in regards to the SCA?
I think mine would be missing cues.
Perfect. Perfect. Missing cues. That's a very important thing. How can you tackle missing cues? We are all, or almost all of us, are actually migrant doctors, IMG doctors. The problem is, I mean, no matter where we are from, the problem is our way of consultation in our home countries is different from we consulting patients in the UK. Patients in the UK can be what we call emotionally reserved, meaning that they will not tell you everything until you are really interested, or they can tell you things in an indirect way. And now your task, your homework is to get that out of the patient, to understand more. Missing cues. How can you tackle that in an easy way? Patient is telling you, okay, doctor, I've been through like various things through my life and I'm not feeling all right in myself. Okay, so you mentioned to me that you've been through various things in your life. Can you tell me more about that? So throwing at the patient some open question, specifically at the beginning, the patient will open up to you and will let you know more. So if the patient tells something and then stops, you think about, does the patient mean something with that, or shall I just move on? This is a very important thing. Think about it. Doctor, I've been through a lot. That's a cue. That is a major cue. Okay, oh, I'm really sorry to hear about that. Please, can you tell me more? What have you been through? Because you mentioned that you've been through a lot. I'm so sorry to hear about that. Must have been a very tough time for yourself. Okay, missing cues can be very achievable, and you'll be able to ace that point as well. Don't worry at all about that. That's a very, very achievable thing. However, it can be a tricky thing as well. Any other thought, any other fear? Okay, I'll get it. That's, you're not having any other fear. You're very courageous.
One more thing.
Yes. Yeah, sure. Go for it.
Misdiagnosis?
Missing diagnosis.
Misdiagnosis, yeah.
Perfect. I'm going to ask you a question, Dr. Riham. In every single patient you see in GP, do you need to have a diagnosis?
Not all of them. Yeah,
No.
a lot of cases there is a lot of uncertainty and
Exactly.
yeah.
Definitely, you're absolutely right. So you don't have to have a diagnosis for each patient. Actually, a major part of you as a GP is that you need to deal with uncertainty, because we don't have all of the facilities that we have in primary in secondary care, and we need to know how to deal with the uncertainty. Okay, where does not knowing, let's speak about a patient coming to you and they are suffering from headaches, and you're not quite sure about the headache itself and all are vague questions. So when does it come from? When you don't know the diagnosis. So for example, a patient is telling you all of the possible information that you need to diagnose a migraine. However, you didn't get that's a migraine. So where is the problem here? The problem here is either you haven't asked the right questions, or you haven't put the right answers into a context. I'm going to answer this question because it might be a little bit vague. Okay, so for example, patient now is coming to you telling you, doctor, I have this headache and it's been ongoing for a few weeks now and it's really terrible. Oh, I'm really sorry. So that's a cue. Oh, I'm really sorry to hear about that. Can you tell me more? Okay, and then you didn't ask the right questions about headache. I'm just giving an example. Is it on one side, both sides? Does it get worse by bending forward, for example, by coughing? Do you get any visual issues at all? Any loss of vision, any blurring of vision? So now you're asking questions in data gathering. You're getting information. If you missed questions in data gathering, you will never reach a diagnosis. However, if you ask it all of your right questions, if you ask it all of your differentials in the right way, you will definitely get a diagnosis. If you didn't get a diagnosis after asking the right questions and getting the right answers, then this means it's an uncertainty. And if it is uncertainty, me, as I'm just like assuming I'm an examiner, I would like to hear you saying it's an uncertainty case. Okay, so Mr. John, from what you've told me, and based on examining you, for example, or based on the information that you mentioned to me today, it's a little bit of a dilemma here. Okay, so it could be migraine, however, it could be also tension type headaches. However, let's work together to try to help treating your headache. For example, I'm just giving an example. Okay, so any other question, any other fear about the SCA? Right, so let's move to the next slide. So do you struggle more with starting or finishing the case? I know the answer here for most of you, but I'd like to hear from you as well. Do you struggle more with starting or finishing the case? So do you take much time early on, or do you take time in the management plan and do you struggle to finish? Or do you have both of them? Don't feel ashamed, just share with me.
Well, I think they're all connected because for me, I take a lot of time in history taking, and when I got to management, I'm just wasting a lot of time in history taking, IBS, and you know, I'm not finishing the management in time. Maybe missing important things like, you know, safety netting or follow-up plans, or you know, didn't check for understanding because I'm just, you know, behind in time. So yeah.
I'll ask you, thanks so much, Dr. Reham. Thank you so much. I'll ask you a question, and please honestly answer this question. Do you have a strong structure in the data gathering?
Well, I'm not quite sure. I think I am, but I don't know.
Okay. Well, okay. Yeah, I'm sure you have a quite good structure in the data gathering. However, not applying the structure, and we'll never know until we see that actually in real life. However, if you're not applying that structure in 6 minutes, unfortunately, so this means the structure needs to be adjusted. Okay, because you might be asking questions in a longer way, for example, or you might be asking some unnecessary questions, which is absolutely very common with many doctors, which is not a shame, and that's something that can be really changed in no time. Okay, and yes, you're absolutely right. If you are not finishing the data gathering on time, actually 6 minutes, maximally by 5 minutes, you will never find time to finish your management plan. Actually, that's going to affect your data gathering and your interpersonal skills, you're relating to others, and that's going to affect your management plan. So it's not only your management plan that's going to be affected, but it will be your interpersonal skills, you're relating to others. Do you know why? Anybody knows why both of them will be affected? If you finish your data gathering late. Yeah.
I think because interpersonal skills is going through the whole consultation, including the management as well. So we need time in the management to show interpersonal skills in this part as well.
Perfect. Perfect. Well done, Dr. Ahmed. Thank you so much. So the most important thing, giving time in management is not only about finishing everything in management. Actually, if you do finish everything in management without giving the patient time to answer you back, to share a decision with them, you're not gonna clear pass on management, and you're gonna lose marks in your relating to others. It's not, remember, it's not a one-way lecture, okay? It's not a one-way lecture. It's a shared decision-making between you and the patient, okay? Again, remember, it's a shared decision-making. How can you make it shared only in 4 minutes? Think about it. How can you make a shared decision management plan in only 4 minutes? Okay, so you need time. Obviously, you need time. If you exceed 6 minutes, every single second after the 6 minutes is actually, it's a negative second, a negative mark. You're not going to get more information after the 6 minutes. Maximum is the first minute and you move on. Actually, after the 5th minute, if you still keep asking questions, you're going to be marked down, guaranteed, in the management plan. Okay, which is the last thing that we want to happen. So again, gaining the balance between data gathering and your management plan is very important in your SCA. Very, very important. I can't stress much about that. Okay, that's a good question. Let's move to the next one. Which type of case throws you off the most? So which kind of consultations that you find really challenging? Which kind of consultations that you find really challenging? I know the answer beforehand, but I would like to know from you guys as well.
Vague cases.
Sorry, Dr. Ilham, say that again.
Vague cases.
Vague cases, okay. I mean, every single case can be a vague case, but what kind? So, for example, some people tend to struggle with mental health, for example. Dr. Farah, you said kids, okay. What else? I was waiting to hear a specific type of cases, like real life scenarios that you normally struggle with, but I haven't heard that yet.
Bad news.
Breaking bad news, okay. But how about ethical dilemmas? Are you all perfect with ethical dilemmas? Is everyone here perfect with ethical dilemmas? Is that the best type of cases that you are able to deal with? Or is it difficult for you at times?
Yeah, sometimes it's difficult, yeah.
Sometimes it's difficult, yeah. Any other type of cases that you feel, oh no, I'm really worried, I'm really scared, I don't want that to come in, you know, I don't want to see a patient with you know, depression. I don't want to see a patient with allergy, for example. Any other cases that you really feel that, oh, that's scary for me. No, I don't want to see that patient. Traveling community. Okay, thanks so much, Dr. Ahmed. Yes, that is one of the most challenging cases. Where does the challenge come from? So community and travelers actually. So traveling patients, they are a little bit, you know, can make you actually a little bit anxious. The reason why behind that is actually, so first of all, they don't have a long-term GP, okay? They are coming to see you today, maybe tomorrow they are coming to see a different GP in a different city. So you need to be aware about that difference. Cultural difference is very important to be aware about. Okay, how can you deal with that? How can you deal with a patient who is actually every few weeks is in a different city? How can you deal with that? I'll give you an example, and I will need you to tell me how. It's a real life example. How can you deal with that? A patient's coming to you today, and this patient actually is coming to you. Let's say, for example, they are coming because they, having a cough. So the cough has been ongoing for a while and coming to you today. And upon asking them, they're telling you, doctor, I'm really traveling and I cannot come to the practice because I'm packing, I'm traveling in a few days' time or something. And the patient's coming to you. How can you deal with that patient? I need some answers. How can you deal with that patient? The patient is traveling and he's coming to you today, telephone consultation, and he is having a cough, telling you, doctor, I'm coming to you today because I'm not sure what's going on, and I have had cough for long time, maybe 3, 4, 5 weeks, and I need your help, I need your support. Can you please prescribe me an antibiotic, for example? This is my ice. How can you deal with that? How can you deal with a traveler? So in data gathering, what kind of questions you need to be aware about? Anybody can volunteer and tell me, please. In terms of a traveler, I don't want to know about any other medical questions. I am a traveler now. What information you need to get from me in order to reach a safe management? Dr. Riham? You unmuted yourself, so that's why I assume that you're about to say something.
I also, I'm not sure, to be honest. So
Okay.
apart from the medical part, I think I would need to know where is he going, how long he's going to stay, is it going to be for short-term period, is he has a medical insurance, anything you could help, if he's traveling alone for emergency, certain thing. Yeah.
Perfect. You actually did it all. Okay. So you need to know, when is he traveling? Where is he traveling to? And has he got travel insurance? Of course, travel insurance mainly if he's traveling abroad, but inside the UK, he doesn't have to have travel insurance. How long is he going to stay there? Okay, is he going to stay with someone or is he going to stay on his own? Okay, so all of these are very important questions. All of these are very important questions. Haven't mentioned, if a patient is temporarily registered with you today, you need to know, why is he temporarily registered with you? Does he have a long-term surgery? And he is here just because he is visiting family, visiting friends for a short period of time. This is a very important thing, because if a patient is coming to you temporarily registered, this patient, if anything happens, his next GP needs to know about what happened to him and what kind of treatment has he received. So traveler community is a very important thing that you need to know in order, in your real life. That's a very important thing. Very, very important thing. Before we move on, any questions so far? Has anyone got any questions so far? Okay, so I assume that we are fine with that. Right, so next question. How do you approach cases where the diagnosis isn't obvious? Now, we have spoken about something similar to that with Dr. Riham, but any other ideas? Anyone has got a different approach. How do you approach cases where the diagnosis isn't obvious? Any ideas? So, yeah, has anybody got?
Yeah.
Yeah, Dr. Saleh, please.
Yeah. I usually put a differential and work on asking questions to exclude or confirm one of them and explain to the patient and the management.
Perfect. Thank you so much, Dr. Saleh. Remember, you are a GP. Remember, you are a GP. So, GP, general practitioner. You don't have to always have a diagnosis. If you are uncertain, you are uncertain. Trust your sense. You are uncertain. Then, if you are uncertain, so you can say it could be this, it could be that. But let's work together in order to reach a diagnosis, in order to get to the bottom of it. We can do examination, we can do some specific tests, for example, but it's very important to share your thoughts. Again, remember driving tests. If you don't share your thoughts with me as an examiner, I will never know what are you thinking about. I'm not a magician. So you need to share with me, what are you thinking about? So it could be this, could be that. Well done. However, if you say, oh, I think you have a migraine, but the patient is coming to you telling you, oh, doctor, I have stress and I have pain around my head. Sometimes feels like bend, but again, sometimes it happens in one side. How on earth can you know that it's only migraine? And why is it not tension headache? You need to show me that it could be, what are you thinking about? It could be migraine, but also could be tension type headache, for example. Okay, so very importantly, share what your thoughts are. And trust me, you're going to get very, very good marks if you do that, only if the case is uncertainty, all about uncertainty. But if the diagnosis is obvious, if you ask the right questions, and if you don't know the diagnosis, so at that time, you know, there are no excuses. So, but if it's uncertainty, it will be, you will be, you know, it will be very obvious. You will know that's an uncertainty scenario. Perfect. Any other approach? Anyone else has a different approach? I'll give you an example. I need you to give me some answers. So a patient is coming to you. Again, I like headaches. I mean, I don't like headaches in real life, but headaches as an example is a very great one. And the patient is telling you, doctor, you know, I am worried about, you know, brain tumor. I'm worried about cancer because I have been losing weight. I have headaches. Headaches are on and off and are on one side, but I have been also losing weight, and I'm really worried about that I am having cancer. How can you deal with that? How can you deal with that? Any ideas?
Hi.
Hi, Dr. Fatma, how are you doing?
I'm good, thank you. So I would usually explore all red flags symptoms like vomiting, early headache, increasing headache when bending down, and if these are positive, then yes, I will need to either arrange a CT or I would arrange a CT. If there isn't red flag symptoms, but there is weight loss, then I will investigate for weight loss as well as headache, making sure there isn't any red flag symptoms of space occupying lesion. But I will rule out any space occupying lesion before wait and see or excluding any serious diagnosis here. Yeah.
So now I am a patient. How would you explain that to me?
Okay. Can you tell me more about that headache?
Okay, doctor. So it normally comes from one side. Sometimes I get some, you know, flashes of light. Sometimes I get some like loss of vision on one side. It only lasts for a few seconds, but also I've been losing weight. I've been feeling nauseous as well at times. And I'm really worried, doctor. You know, I've lost a couple of stones over the past few weeks' time, and I'm not sure why. I've never lost any that amount of weight before. So now I'm worried about cancer. Now you, Dr. Fatma, move on to the management part and tell me what you're thinking about at the moment.
Well, if I explored everything and I suspect the weight loss is due to the red flag diagnosis, then I will explain that I am concerned that could be serious and I might need to do a CT scan to the head to make sure
Yeah.
it is not some tumor or cancer in the brain. I will explain that clearly. If
So
it is not, if
yeah,
it
go
is,
for
then,
it. Sorry.
yeah, if it is, then we know why you've lost weight. Otherwise, if there isn't, then we will need to follow up and arrange for a face-to-face appointment to see what possible causes of weight loss other than the headache, because they might be coincident, but I will rule out a tumor in the brain or lesion in the brain before.
Okay, thank you so much, Dr. Fatma. I need anyone else to let me know about how would you do that in a few lines. How would you explain that to me again in a few lines, please? Now I'm a patient. You are not quite sure whether is it a brain tumor or it could be migraine, could be something else. How would you explain that to me in a few lines? Anybody knows, apart from Dr. Fatma, of course. Dr. Reham, yes, go for it.
I was going to ask, I'm quite sure, I'm not sure.
No, that's absolutely fine. So, yeah.
No,
So,
I'm asking regarding the patient. So, are we sure that we are not, indefinite diagnosis? This is unlikely or likely to be brain tumor?
Okay, we're not quite sure. We are not quite sure. What I want you to say in a very easy way, it could be the best case scenario. It could be just migraines. However, I don't want to miss anything sinister. And by sinister, I mean brain tumor. Now, I'm not saying that you have a brain tumor, but that's something that we need to consider carefully, because you mentioned to me that you've been losing weight over the past few weeks as well, in addition to the headache that you've been getting on one side, and also mentions that you lose vision and you're also feeling nauseous. So it could be the best case scenario, it could be just migraine, but again, because you mentioned to me red flags like losing weight, so we need to be very cautious about that. Okay? Apply that to every uncertainty, specifically if you are not sure whether or not you're dealing with cancer. If you are dealing with cancer, so that's a very serious diagnosis. So now, if you are uncertain whether or not the patient has cancer or something else, which one you would be penalized if you don't deal with as a doctor? Again, if you are unsure, so now if you do think, oh, could be cancer, but I think it's more likely to be migraine. So let's treat migraine. If a migraine doesn't get treated, then, oh, okay, we'll think about cancer. How do you feel about that approach?
Definitely a no.
Definitely a no. Why a no?
Well, you might miss a serious diagnosis, which will the patient safety.
So you will be unsafe doctor. Remember, you will be an unsafe doctor. If you are an unsafe doctor, that's not all about, being a GP. So you can't be a GP if you are unsafe. Okay? So you need to be safe. You need to act safe. You need to show me, as an examiner, for example, that you are a safe doctor. Okay? So if you are uncertain, however, there is 1% possibility that there is a serious diagnosis, like cancer, like a stroke, for example. A patient, for example, lost vision for a few seconds, and he regained his vision back, so that can be a TIA. Okay? So if you don't act on this, you are an unsafe doctor. I mean, not you personally, but you, the examiner, will consider you as an unsafe doctor, and you might fail, unfortunately, the case. Okay? So, very important, if the diagnosis is not obvious, think about uncertainty. How can you deal with uncertainty? Best case scenario, worst case scenario, whatever your way is, but you need to show me that there is a dilemma. There is a dilemma. Okay, there's a dilemma here, Mr. John. Unfortunately, there's a dilemma here. So it could be something like migraine. However, based on what you've told me, I don't want to miss something sinister. And by sinister, I mean cancer. Okay, and that's why we need to act very carefully on it. I don't mean to scare you. However, we need to take that very seriously. Okay. Perfect. So let's move to the next question. What's your structure when starting management? How do you normally start your management plan? Anybody volunteers and tell me, how would you start your management plan? Just your management plan. What's your structure? Anybody knows? You're all appearing, hopefully, you're all appearing for the SCA in the next few months' time, and you definitely have a structure. Dr. Raj, please.
Yeah, so I'll basically, after I've heard the history and I've given the patient the possible investigations that I might do, or what I'm thinking, the possible differentials, I'll probably start with like, so Mr. John, from everything that you have told me, this is what I'm thinking, and therefore perhaps therefore we would need to do a few tests, some blood tests to investigate further, something in those lines.
Right. So to me, the best way to start your management plan is actually address the patient's ICE. So if you know the patient's ICE, if you ask the patient his or her ICE early on, now you get the patient ICE. So for example, Mr. John, I heard you saying about that you're worried about a brain cancer, and also you'd like us to investigate that more by doing a specific test. And in addition to that, you're worried that you'll be unable to continue your work because actually your work is quite physical, and if you have a brain tumor, you might lose your job. Did I get that right? Okay, then the patient confirms that you got that right, and then start. Okay, so let's break that down. Okay, so from what you've told me, I'm giving another example. I don't think it's a brain tumor because you mentioned to me that you don't have any weight loss, you don't have any arm or leg weakness. So I am reassured that it's less likely to be a brain tumor. However, what I do think it's most likely here is something like migraine. We can have a chat about that in a minute, and I'll explain what migraine is. Would you like me to explain what migraine is? Blah, blah, blah. Okay. Then, now you mentioned to me that you're worried about your work, and let's work together in order to help you, not losing your job. In addition, you mentioned to me like you would like a CT scan. However, based on what we think is happening here is migraine, so CT scan will be very unlikely to show us any abnormalities, and that exposes you to much radiation unnecessarily. Now you addressed all of the patient concerns. You address the patient's eyes. This is what I want to hear from you. Okay? Address the patient eyes, because first of all, now you take the box for ICE. ICE is not only about asking the patient. ICE is also about addressing the patient's eyes. So you did a great job by gathering information from the patient, but also address that early on. Now, me as an examiner, I heard you telling me that you know what my ICE is as a patient. Now you are answering my ICE back. Now, well done. You got a clear pass in relating to others. Okay, so this is a very important thing to start with. Gather information from patient. And what is the second benefit from recapping patient's ICE in the start of the management? What is the second benefit? Anybody knows? There is another benefit from recapping ICE early on in the management part. Right. So the second benefit is that you're reminding yourself on what the patient said. So you said this, you said that, and you said that as well. Is that right? Now you're reminding yourself in the management, and now you are acting on what the patient told you. So now you're reminding yourself with the patient ICE. Now you're answering the patient's ICE. Okay, so you have two benefits. So the benefit is that you're showing the examiner that you hear the patient, but also you're reminding yourself with the patient's ICE, and now you're acting on it. So that's a benefit of starting with addressing patient's ICE. The rest of the management plan, we can have a discussion about that because it can take a long, long time. But this is what we are applying in our mock sessions. Perfect. Any other question so far? Has anyone got any question? I hope that's all now clear so far. So, have you ever felt like you passed or failed a mock case? Whenever you're doing any mock cases, so have you ever felt that you passed or failed a mock case, and why? Please, I would like to hear some answers here. Have you ever felt like you passed or failed a mock case whilst you're doing mocks or even doing practicing with your peers? Have you ever felt that, oh, I'm not going to pass this? I am going to pass this case because I did this, and that. Tell me, has it happened with you before? Has it happened? Oh my goodness! Because actually, I didn't answer patient's ICE. No, I'll definitely have failed this case. Or I didn't safety net in this case. So no, I'm not going to pass the management part. Has anyone passed through this before?
Or I didn't finish in time.
All right. Okay. Then what did you feel? Did you feel that you're going to fail the station because he didn't safety net the patient or not, Dr. Rehan?
Yes, because I think my main problem is the time management. Yeah. Time
management. Okay, that's absolutely fine. However, in time management, still you can, tell some, some like phrases in management part anyway. I'd like to reassure you, even though if he didn't safety net the patient, that still doesn't mean that you're gonna fail the station. That's a very important thing. However, there are core things that you shouldn't be missing. So for example, if you missed asking about ICE, if you don't know what the patient's ICE is, how likely that you're going to pass in relating to others? I'd like some answers. How likely you're going to pass a case if you don't, like not a case, but relating to others in one of the cases, if you forgot completely to ask about patient's ICE, how likely you can pass?
Unlikely.
Very unlikely. Thank you so much. Thank you so much. Very unlikely, Dr. Rehan and Dr. Ahmed, thank you so much. So now there are core things in the case that you shouldn't be missing, and there are sugar coating things. If you get the sugar coating things, you're gonna clear pass. But if you don't get them, but you get the core of the case in front of you, then you can still pass the case. So now you will have a hard feeling whether or not you have passed or failed. However, again, many people after going through the exam, they feel that they have failed the exam, however, they still pass, and sometimes vice versa. Okay, but when you get that strong sensation, if you have been doing that for a long period of time, if you have been practicing the right way, this is the most important thing. Many people whom I know have been practicing for months and months and months. They still don't pass the exam. Why is that? Because they have been practicing the wrong way. However, if you have been practicing even for a month's time the right way, you can still pass the exam. You can still get a very good score as well. Okay, so again, all of these, we're going to have a chat about them. But again, remember, there is a core for every single case. A core, if you manage to get that core, you're going to pass. If you don't manage to get that core, unfortunately, you might fail the station. If you're going to get the sugar coating, we can speak about that as well at some time, then you can clear pass the case. Okay, any questions so far? I hope that's now clear. Right, have you ever had a complete blank moment mid-case while practicing? So whenever you are practicing, did you have a moment when you were absolutely stopped? You're getting blocked mind and you don't know what to do. Did that happen? Has anyone been through such a thing? Whilst you are practicing, then all of a sudden you had a blank, moment when you, oh no, just mental block. I don't know what to do. Has that happened with you before? Dr. Raj, please.
Yes, it has happened with me, and this has happened with me, especially while dealing with consultations which I'm not very familiar with, or from before I know I'm weak at it. So something like HRT, for example, which is a very big and difficult topic. So yeah.
And what did you do when you didn't know about the HRT?
Well, to be honest, I had a blank. I think I had a blank look on my face, and I was like just staring. And after I think a few seconds, which felt like a long time, I tried to gather some basic information or basic information that I could remember that I need to ask regarding HRT while consulting, doing consultation regarding HRT.
Thank you so much, Dr. Raj. Yes. But what do you do at that moment? At that very, very, it looks like a long time. However, it's a few seconds. It feels as if it's a long time. What do? You now stopped. You're having a breakdown. What do you do to tell me I'm a patient now?
Well, I think I just get quiet, looking around the room. Yeah.
Yeah. Okay. So you can say, yeah, I'm really sorry. I'm just trying to gather my thoughts at the minute in order to try to get to the bottom of what's been going on. I'm gathering my thoughts. Okay. However, I'll tell you a trick. I will tell you a very important trick that's really proven to really help in hard times. If you need some time to think about something whilst you are speaking to your patient, has anybody tried a trick before? A specific trick, which I normally do. Dr. MVP? Sorry, were you about to say something? Okay.
Can I say something?
Please, Dr. Fatma, go for it.
Okay, so when I feel blank, either because of what's going on in my life or because what the patient said confused me, I usually try to briefly say what I can remember from what he said. And then, for example, if they have abdominal pain or she has abdominal pain, and I will say, okay, so you've been suffering from abdominal pain for the last 3 months, and recently you've also noticed weight loss. Okay, is that everything? So I would go like that. And because if I go blank, then that means I did not follow everything that the patient said. So now I'm tempting the patient to repeat themselves in case I did not get it without saying, could you please say that again? Yeah.
Perfect. Perfect. Right. Okay. Thank you so much. Thank you so much, Dr. Fatma. However, what you're trying to say, which is absolutely perfect, is recapping. Recapping, summarizing what the patient told you. Summarizing what the patient is telling you. That's a very important thing. Now, you are telling me as a patient that you've already heard me saying this, this, and that, but you're also gathering your thoughts. You're gaining a few seconds to think about what my next question is going to be. Dr. Reham, thank you so much as well for sharing what you mentioned, checking the notes. How do you feel about checking the notes while you're speaking to your patient in an exam? I need you to tell me, guys. I need you to tell me, great doctors.
Well, I think it's
How
valid
does it
if you
feel
do
like?
it. Yeah, I think it's valid if you do it just for a few seconds. Sorry, I was
Yeah.
just checking the note. I'm just checking something important. I'm checking lost blood test, anything like that, or your medication. Especially if it's related to that context of speaking, it might be a valid point.
Okay, that's perfect. Thank you so much, Dr. Ham. You can say, I can see from my notes that you're taking this medication. Is that correct? Yes, perfect. However, if, for example, you have a long note from hospital, okay, and to you as a GP to read, and now, oh, sorry, I just want to go back to the note, just having a quick look again. Now you had 3 minutes. You had 3 minutes to read before the case. You had 3 minutes to read before the case. So if you haven't read that very well, there is a very big chance that you might get marked down if anything in front of you has been written. So there is a chance you're asking the patient if you don't reflect. So how can you reflect? I can see from my notes that you had that sort of medication and that was stopped by hospital. Is that correct? Yes. However, if you keep doing that and doing that and doing that overly, the examiner might think that you didn't read the notes and you can get marked down. So if it's only within the context, so for example, if you have a great structure in your data gathering, you always need to know that you need to ask about most of the cases about family history, about medication. So now I asked about medication, I asked about family history, this is fine, but don't overly do it. Sorry, I wanted to have a quick look in your notes just because I wanted to get some information. No, if you ever do that, you will definitely lose marks. So it's a double-edged weapon. So be careful when it comes to using the notes. You use the notes only in context, only if you haven't asked the question like for medication. So I can see from my notes that he takes this medication, or I can see from my notes that you don't take any medication. Is that correct? I can see from my notes that you don't smoke or drink alcohol. Is that correct? Oh, yes, doctor. Okay. But don't overly do it. Yes, Dr. Reham, yes.
Sorry, I was just saying that as an excuse if you all had a blank moment that you can explain to the patient. Sorry, I'm just looking to the note, checking something.
No.
What you have for
No.
No. Okay.
I'm really glad, Dr. Reham, that you raised that. So there is a box, okay, a box in your data gathering that you haven't heard the patient properly, or you haven't checked the notes, sorry, properly in your 3 minutes. And that's why you're having 3 minutes, okay? So never do that. But summarizing is a very good point to do, okay? It can waste a little bit of time. However, that's still within context. You're showing the patient, you're showing the examiners that you've already heard the patient talking. Okay, so perfect. Now we know what to do. What's one phrase or question you always use in your SCA cases? That's a very, very fun question, just out of interest. What kind of phrase that you normally use? What kind of sentence, what kind of words that you normally use whilst you're practicing? Or even in daily life?
Can I start?
Yes, please start, Dr. Fatma.
So when I want to show empathy, I would always say, oh, that must be very difficult to go through. That is during data gathering. And in the management, I usually, it's the same sentence. I usually say, would you like to consider that? And it's very frequent. I would use that most of the time.
Okay, perfect. And how did you know that you're using it?
Well, I study with some people, but I've noticed it myself. I also noticed it myself. Yeah.
You've not said yourself. Perfect.
Yeah.
But did you know there are lots of other things that you normally say? You normally say whenever, and still you don't know about them.
No, not really.
You don't know that. And how do I know that? Because I was in your situation, I was in your position. But how did I know that? How did I get to know that? How did I get to know that? By recording myself. By recording myself whilst I am practicing. If you can do that with patients, perfect for your 14 fish and perfect for your supervisor to see you, because you'll never know. You might be doing the same mistake again and again and again, repeating yourself again and again and again without even knowing about it. Yes, if any of your colleagues or during mock exams that's been flagged up, perfect. But if it hasn't been flagged up, because what's going to happen is if you're repeating things in the data gathering and management plan, you're wasting your time and you are repeating as well. So if you are repeating, you might get marked down. How would you know that? Record yourself. Record yourself whilst you are practicing, if you can, and if other peers agree with that. Try to record. Go through it, and then you might say, oh my goodness, why I'm saying this word again and again and again? Why I'm saying okay. I didn't know that. I didn't realize that until I recorded myself. Even if you're doing that with patients, real life patients, that's also a great way of knowing it. You know. Yes. Okay, perfect. So recording is a very important thing. And believe me, that's going to be a very fruitful thing. Right. Now that we are almost approaching the end of our questions for today. So what do you think examiners are really looking for in the SCA? Very open-ended question. What do you think examiners are really looking for in the SCA? Any ideas? Yes, perfect. Safe doctor. Thanks so much, Dr. Farah. Any other suggestions? What else? If you are an examiner and you are marking one of your colleagues, patient-centered, perfect. What else? What else? If you are an examiner, you're marking one of the GP trainees, what else would you like to hear from them adhering to nice CKS? Dr. Ahmed, thank you so much. Okay, use resources appropriately. Perfect. What else?
Independence.
Okay, independent, however, showing limitations. Dr. Fatma, thank you so much. Really, thank you so much. It's very important. You are a GP. If you are a GP, you need to take responsibility. If you are a GP, you need to take ownership. How many percentage, roughly, you as a GP or a GP trainee, that you're taking ownership in and how many percentage that you're referring into secondary care? What do you think? What is a percentage of taking ownership or referring? Okay, 80% of referring or 80% of ownership, Dr. Ahmed? Okay, so perfect, thank you so much. So 80% of ownership. So trust your sense. Would you refer a patient? So if you ever had a patient that you've never seen before, or a new case that you've never been across in your day-to-day life, trust your sense. There's something that I can deal with as a GP, or should I refer? Why I'm saying that? Because if you do refer unnecessarily, there is a major risk that you can lose a big chunk in your management plan. Okay, so taking ownership is very important. Don't always, oh no, I'm going to refer this patient into rheumatology. So what is your responsibility here as a doctor? You should have a great responsibility. Okay, so again, that comes from what? Comes from knowing the guidelines. Very important. So knowing guidelines is important in your management part. Being patient-centered is important as a part of your relating to others. Okay, and in addition to that, also gaining information as a part of your data gathering. Without that, it's very unlikely that you're going to reach a diagnosis, or at least a set of diagnoses as a part of your uncertainty. Okay, perfect. Now, any questions so far? Any questions so far? Okay, so thank you so much so far. Thank you so much for bearing with me, and thank you so much as well, Dr. Hisham, for waiting with us. Now we're gonna move to the next part of our session for today, which is a very, very important part, with our brilliant doctor, Dr. Hisham. As we mentioned before, Dr. Hisham is one of the top scorers in the SCA. He got 109.5 in his exam. Congratulations and well done, Dr. Hisham. You are a very, very brilliant doctor, and we would like to know how did you get that top score? It's a very, very wonderful score, Dr. Hisham. Dr. Hisham, are you with us now?
Yes, I'm with you. So thank you very much, Dr. Khaled, for the introduction and for giving me the chance to speak to everyone today.
It's my pleasure, doctor. Thank you so much, Dr. Hisham. Well done, well done. I wanted to say, like, really well done, and it seems that everyone is really happy with your top score here.
Thank you. Thank you, everyone.
Thank you so much. Yeah, so I'll give you the opportunity to tell us how did you get that.
So thank you. So I'll try to summarize what I did, and I'll just try to give just quick tips if it may help anyone. So to be fair, I had loads of worries before the exam, especially with my English being my second language. It's very basic. I thought the maximum that I will get will be borderline pass, for example, because of my English. So that's why I thought I need to avoid any kind of mistakes to manage to pass this exam. But it looks like you can have an accent, you can have basic English, you can still make mistakes, and you can still score high. So I did many exams before. I did usually MRCB and more, but this exam is very stressful. I think this is the most stressful exam I have ever had. And you need to prepare yourself mentally before the exam. I think being calm and confident during the exam itself is even more important than the knowledge or the preparation itself. So the cases are very simple, no much complexity, very similar to what you have on daily basis in your GP practice. And I don't think you will have a patient coming with 3-4 complaints like real life, for example. So, and also you will not have a very complex case. Most of the cases are straightforward. People pass this exam after failing 10 domains and more. So you may need to stay calm and try to reassure yourself before the exam, knowing that you can still fail some cases and you can easily pass the exam. I got clear pass in some cases where I did some mistakes. So even if you do a mistake, it doesn't mean you lost the case. You can still manage to get a clear pass.
Okay. And Dr. Hisham, sorry to interrupt, but just out of interest, how about these cases that you scored really well in? And you mentioned that you had some mistakes. How did you feel after the exam? Did you feel that you are going to score that good? Or did you feel, oh no, I'm not quite sure? Or did you feel, oh no, I didn't really do very well in these ones?
I see. So no, I never expected to score high. So I was always thinking, am I going to pass? Am I going to fail? But I never thought about scoring high. Yeah, so because you're doing the exam for the first time, you don't know how the examiners are seeing you. You may give them all the right answers, but they don't like you for some reason. So this is why it's very, very difficult to expect your marks. And I never expected to score high during preparation or after the exam. Okay. And as I told you, English, for example, was a worry for me, but it's fine. It's fine for IMGs to score well.
Mm-hmm. So, Dr. Hisham, what did you do? I mean, because you mentioned that English, and I can see that your English is very good as well, by the way. But what did you do? Did you use like specific sentences to help you during the exam or during your preparation with other colleagues in order to strengthen the way of your telling things to patients, or what did you do?
Yeah, sure. So I think the main thing is to practice with as many people as you can. It is more than the number of the cases. It's more important to practice with strangers, go out of your comfort zone instead of just practicing with your friend all the time. Try to practice with strangers. This is very beneficial. Practice with British colleagues. They will give you different kind of feedback on your communication skills, which is helpful. I thought so. When I was practicing with people, I used to write the phrases that I liked as a patient and keep it with me. So I read it again and again and try to use it naturally. So I remember one of my friends who had feedback that he's using a rigid structure and some phrases as not natural enough. So you need to find a balance to use some nice phrases, but at the same time, make sure it is natural.
Perfect.
I think doing mocks before the exam was very helpful for me. I did a mock exam with you, Dr. Khaled, and this was very beneficial. It is very important to do the cases under stress, do 6 cases back to back, then get a feedback. This is more similar to the exam because during the exam, no one will tell you if you did well in the previous case. So when we practice with each others and feedback each others after each case, this is not the same as the exam. You need to deal with your uncertainty about your performance after each case. And so I would encourage people to do mocks. You can do mocks with your colleagues as well. So instead of practicing case by case, you can do 6 cases followed by 6 cases. As I told you, I'm planning to do some mocks with my British colleagues just for educational purposes. Happy to do that for free for anyone. And regarding to other tips, as you mentioned during your brilliant lecture, active listening is very important. It's not only about listening, it's about showing your listening by repeating the words of the patients and assessing their psychosocial situation, asking about their mental health. For example, there is a phrase one of my British colleagues told me about it that I tried to use it and I liked it. So I used to ask how this affects your mental health, but my colleague is saying, is this taking a toll in your mental health? So it's very small changes that I'm trying to make to my questions, but I think it's making a difference. So,
sorry, Dr. Hisham, again, how did you practice with? Because some people find it like slightly difficult to practice with like a British colleague, you know. So how did you do that? Did you, for example, maybe like do that in your practice, in the deanery, or how did you manage to do that?
Yeah, so I had some colleagues who are in the same deanery. So we've been together for 3 years, and it is beneficial for both of us. So they were happy to practice with me, and I learned it a lot from them, and I believe they learned it from me as well. So it is a win-to-win situation. And also there are loads of free WhatsApp groups. So sometimes I just write anyone free to practice. So I was happy to practice with anyone as random people. It's much more beneficial for me than practicing with a friend, because somehow I expect the feedback that I'm going to hear from my friends at a point of time. And I don't mind hearing a very negative feedback, because we can take what we want from the feedback. So if the feedback is very bad, just take what's with you and ignore the rest if it doesn't make sense for you.
Of course. And Dr. Hisham, I can remember doing the mock together. We had a very nice feedback, and you're absolutely also like amazing as well.
Thank you.
But again, what the take-home message? Because of course, I mean, every single one, you know, every single doctor, they have their own strengths and weakness points. Even though any weakness points, you took that actually on board, and you acted very well on that. And I can remember the mock exams that we had wasn't too far away from your exam. I think that was only a couple of weeks, I think, as far as I remember, or even less as well. So you even in the exam as well, you showed very, very good improvement in every single domain. So what did you do differently after having the mock, or what did you apply what we had a discussion about, or what did you do at that point?
Yeah, sure. So when you practice with someone, or when you do a mock and you get a feedback, it's not only about practicing, it's about taking this feedback into consideration and trying to apply this advice on your practice after that. So, for example, when we did the mock, this was a kind of different situation for me, because I was just practicing very relaxed situation with my friends. So doing the mock under somehow stressful condition, trying to make it similar to the exam was very important. And it made things easier during the exam itself, because I felt like I did something similar to that before.
Exactly. So putting yourself in that stress is very important, Dr. Hisham, isn't it? Like being in that adrenaline possession before the exam is very, very important. Yes, you're absolutely right. Yeah.
Exactly.
Dr. Hisham, let me ask you. Yeah, go for it. Yeah, sorry. Yeah.
Yeah, and also before the exams, a week before the exam, I used to go to the practice every day. You practice from the same room, same computer, just to get used to things. So the mocks, practicing with different people, doing mocks with professionals, it's kind of multiple things that you need to do together to be calm during the exam. And I think I was calm during the exam somehow.
Okay, which is good, Dr. Hisham. Very, very perfect. And I mean, me knowing you, your nature is very, very calm as well. Very good and very confident. And how in the exam, I mean, how did you get that to that point of calmness? Is it because that you practice and you had mocks and you've done that for a long time, or how did you get that? Because that's I was going to say a lot of, you know, we receive this sort of feedback from many colleagues that, oh, stress has affected me in the exam. I was, you know, about to say something, but I didn't because of stress. So how did you tackle exam stress?
Yeah, that's absolutely fine. That's absolutely right. I think stress is the main thing that you need to tackle during the exam. So I was very worried before the exam. I tried to prepare myself mentally that it's not the end of the world. If I fail this exam, I can repeat it again. If I need to repeat it again, this means I need to improve myself, and that's fine. I will do the preparation again and improve myself, do the exam again, and I'll pass it eventually. So this is how I try to prepare myself mentally. If I fail, that's fine. I'll repeat it again. So just to release the pressure. So if you do the exam and you have in your mind that I have to pass this exam, and then you have a bad case, in the first case, for example, this will knock your confidence. You need to do the exam with set mind that it's fine to fail. That's fine. They are not judging your knowledge. They are just judging you on some kind of situations, how you react to it. And it is okay to fail the exam. It doesn't mean you're anything about being, I mean, it doesn't mean you are a bad doctor if you fail the exam. It doesn't mean that at all. I practice with some people who are really good, but they didn't manage to pass. And it doesn't mean anything. I believe they will pass the next time.
Yeah, I'm sure they will, Dr. Hisham. I think it's just, as you mentioned, it's like a screenshot of, like just 12 minutes for you. So that doesn't really define you whether or not you are a very good doctor or you're not a good doctor, whatever. So it's only a screenshot for 12 cases. And unfortunately, that's the only screenshot that reaches the examiners. So we need to be very well prepared, but at the same time, you try to be very calm. And that will come from practicing, from mock exams, and doing that for a long period of time is very, very important. So Dr. Hisham, let me ask you, how long have you been preparing for the SCA before you set for the SCA in June?
It's nearly 2 months of preparation, but since my ST1, I have the structure written in front of me during every day. So for 3 years, I'm applying the same structure without changes. And just in the 2 months before the exam, I tried to change it in a way that suits the exam. So as we mentioned earlier, the exam is not exactly like real life with people coming with 4 or 5 complaints. They designed the cases to be finished in 12 minutes somehow. So I just made some changes to my structure. I tried to be more flexible. So for example, if the patient is saying something, I don't have to follow my rigid structure. I can leave the structure, reflect on whatever they said, and dig as much as possible, then go back to my structure and continue as normal. So I think following the structure all the time is really good.
Yeah, that's perfect. And Dr. Raj is asking Dr. Hisham if you could at some point share your structure. Thank you. I mean, it can be a little bit difficult anyway to do that now, but we can consider that in the future as well.
Yeah, sure. I may share my whiteboard in the group if you want.
Perfect. That would be very, very beneficial, Dr. Hisham, please. Yeah, thank you so much for that.
Thank you.
No problem. And any tips or any top tips that you would like to share, or any advice if you're providing the doctors who are setting exams in September, October, and November, Dr. Hisham?
Yeah, so I believe the exam is mainly about psychosocial situations and things like that more than medicine. Do ICE, it's very important. Do ICE as early as you can. And as you mentioned earlier, reflect on it. It's not only about taking the ICE, it's about also reflecting about what you are hearing from them. And show active listening by repeating their words. So shared management, as you mentioned earlier. So I used to have a sentence that I used to say every time. For example, okay, thank you for giving me this information. I will share with you my thoughts. I'm happy to hear your thoughts. Then we can reach a plan together. So I understand we all know that we need to do shared management, but I try to verbalize it to every examiner during every case. So they know that I'm doing shared management. It's not ideal, but it looks like it worked.
I mean, absolutely, Dr. Hisham, because if you have a very good rigid structure, so that's a very, very important thing. What normally happens is you don't think about your structure because you're already used to it. You've been doing it for a long, long period of time. So it just comes out of you, without any effort, out of nowhere. So that's one of the most important things, to have a rigid structure before your exam. And even in real life, that really shortens the time of your consultation. So you're absolutely right, Dr. Hisham. Yeah, perfect. Perfect. And just to make benefit of our precious Dr. Hisham at the minute, can I ask if anyone has got any questions to Dr. Hisham, anything to ask Dr. Hisham about? Because that's a very great opportunity, actually.
Thank you.
Thank you. Any questions to ask Dr. Hisham about? Anything that's not clear at all? Okay, Dr. Raj, please.
Yeah, if you could kindly, I'm just going to start preparing for my SCA, and I hope you will do it in October. So could you please suggest what should be my structure of planning to prepare? How should I go about preparing? What steps should I take to prepare myself? Thank you.
So, sorry, you're asking me about my structures that I used to use during the exam. Is this right?
No, I mean the general structure that I should have. What plan should I have to prepare for the exam? How should I prepare for the exam? Like what steps I need to take to prepare for the exam?
Yeah, as we mentioned, I think practicing with as many people as you can, practicing with British people, doing mocks with your colleagues, doing mocks with professionals like Dr. Khaled, who's experienced in doing that. So it is kind of package. You can't just prepare in a one way. You need to prepare from different point of view. Prepare yourself mentally, prepare yourself from knowledge point of view, but this is not the main thing. Practice as much as possible, because in the exam itself, you will find some situations that you don't want it to happen the first time during the exam. It's better if you have been exposed to the same situation before, because this will make your life much easier during the exam. So, yeah, I think this is the main thing.
Thank you very much indeed. Thank you.
Thank you.
Thank you, Dr. Raj. And thank you, Dr. Hisham. Any other question? Okay, so I assume that we don't have any questions at the minute. And again, thanks so much, Dr. Hisham. You've been really amazing. And I'm really glad for that top score. You're very, very brilliant to have that score. And I'm very proud of you. I'm very, very proud to be a part of your journey as well. It's really my pleasure. And I am hoping you all the best. I'm hoping you a very brilliant future. So thanks so much for joining us today, and well done, Dr. Hisham. Thank you so much.
Thank you very much. Thank you. Thank you again. Thank you.
My pleasure. My pleasure. And from my point of view as well, has anyone got any question at all? Anything to ask me at the minute? Anything to make benefit of this Q&A session? Any questions so far? Anything in your mind? Remember, no question is a silly question. All of the questions are very important to me. So has anyone got any question about the exam? Not the exam itself, like exam structure and how to deal with it. Any question at all? Anything that's not clear?
I just wanted to ask, when would we a similar session again? Like the
When
one you
we-
have.
Sorry, Dr. Raj, your voice is not very clear. I'm so sorry.
Yeah.
Can you
Sorry,
repeat
just wanted to ask, when would you be conducting another live session like today?
All right, okay. So yeah, thank you so much. So it normally happens once every month, but we are planning to do like more in the next, a few weeks time. So I've been doing that previously for a long period of time, for almost 5 months now. However, we're planning to do that on a regular basis as well. And as you may know as well, we offer, like the high yields SCA course, and we offer also the mock sessions, the one-to-one mock session, 6 and 12 cases, also 3 cases. And also we offer the management course, which is going to be in the last weekend of this month. Is going to be a very, very precious course. We've done that before, and now we're doing it for the patient. Sorry, I'm saying patient. Like the colleagues are actually sitting for September's exam, October exam as well. So it's going to be happening at the end of this month. So we're doing that, and it's going to be running on 2 days, actually on the weekend. So Saturday and Sunday, we're going to go through all of the high yield topics, all of the high yield management parts that you need to be aware about, and that refreshes your mind and you find that very clear, hopefully, when you deal with patients in your exam. Any other question? Dr. Raj? Oh, perfect. Thank you so much. I appreciate your words. Yeah, so we'll be doing that on a regular basis anyway. Any other question at all? Perfect. So we need at some point as well to speak about how to make use of your whiteboard. We need as well to speak about at some point how to use the 3 minutes effectively. So all of these are very important. We still have lots and lots of things to go through. I wish you all all the best. I hope you all smash your upcoming exams in the next few months' time. And thank you so much for joining us today. Dr. Hisham as well, thank you so much for your precious advice for today. And I wish you all the best. And thank you so much, everyone. We'll see you again later. Thank you. Bye-bye.